Good afternoon, everyone, and welcome to today's Fireside Chat and the very first one of the year. I'm Amna Hussein. I'm the Community Outreach and Engagement Manager at the Masonic Cancer Center at the University of Minnesota, your host and moderator for our monthly Fireside Chats. The Fireside Chats are brought to you by the Office of Community Outreach and Engagement at the Masonic Cancer Center at the University of Minnesota. Our office serves as a vital bridge between the Cancer Center and communities across the state of Minnesota and beyond. Our small but mighty team is committed to reducing the burden of cancer by actively engaging communities and providing access to relevant knowledge on the latest in cancer research, prevention strategies, the importance of screening and early detection, treatment options, survivorship, and opportunities for clinical research. Each month, we host these fireside chats to share knowledge, raise awareness, and highlight the people and research driving change across the cancer continuum. This month, February, is recognized as National Cancer Prevention Month, a time to raise awareness about the many ways we can reduce our cancer risk. While not all cancers are preventable, research shows that a significant proportion of cancer cases are linked to modifiable risk factors, such as commercial tobacco use, diet and physical activity, environmental exposures, infections, and today's topic, alcohol consumption. Prevention also includes routine screening and early detection, which can identify certain cancers before symptoms appear and even prevent them altogether. Today's conversation is an opportunity to better understand the science behind cancer prevention, especially emerging evidence around alcohol consumption and cancer risk, and the progress being made in this space and what it means. So to help us unpack this, we are so fortunate to be joined by an expert in this emerging field of research. It is now my pleasure to introduce today's speaker, Dr. Silvia Balbo. Dr. Balbo is a professor in the Division of Environmental Health Sciences in the School of Public Health at the University of Minnesota. She is also a cancer researcher at the Masonic Cancer Center and is the co-leader of the Carcinogenesis and Chemoprevention Research Program at the Cancer Center. Dr. Balbo's research focuses on the interactions between DNA and chemicals to investigate how lifestyle and environmental exposures contribute to disease. Before I hand things over to Dr. Balbo, I'd like to cover a few quick housekeeping items. Today's fireside chat will be recorded, and the recording will be made available on the Masonic Cancer Center's YouTube page by next week. Closed captioning is also available for this session, so you can turn it on by clicking the CC button at the bottom of your Zoom screen. For all University of Minnesota employees and spouses participating in the university's Employee Wellbeing Program, you can claim your 200 Wellbeing points for attending today's fireside chat by completing the form that will be dropped in the chat shortly. We also invite you to engage with us, so please use the Q&A feature during Dr. Balbo's presentation. It's located at the bottom of your Zoom screen to submit any questions or comments you have. We have some time carved out at the end to take some questions. So without any further ado, I'm going to pass things over to Dr. Balbo. The virtual floor is all yours.
Thank you, Amna. Thank you for this introduction and welcome, everyone. I'm excited to be the first speaker for these fireside chats for this year with a topic that I think is of interest to many. So I'll start sharing my screen. And Amna, can you just confirm that you're seeing the advancement and everything works fine? Perfect.
They're up and ready.
Great. Thank you so much. All right. As I said, I think that this is a focus or a topic that interests many, and it's really related to what we know about the connection between alcohol and cancer. And this is a connection that is related to the fact that alcohol is a classified group 1 human carcinogen by the International Agency for Research on Cancer, which is the branch of WHO that really focuses on cancer research. It's a risk factor for a number of diseases, but in the context of cancer, is a risk factor for cancers of the upper digestive tract, so the oral cavity, the esophagus, the liver, and many have heard maybe about this connection, but also colorectal cancer and breast cancer risks are associated with alcohol consumption. It is estimated that around 5 to 10% of all cancers in Western countries are actually attributable to alcohol, so a big number. And what is also interesting is that the risk does not seem to change depending on the beverage. So whether we are drinking red wine or beer or spirit, the risk is still there. And so this really points at the fact that it's probably the ethanol in the beverages that is responsible for this connection. And so just to sort of put the numbers a little bit more in perspective here in the US, these are numbers that come from 2020 and 2021 evaluation, where it was estimated over 20,000 people died from alcohol-related cancers each year in the US. So as you can see, this is an important number, it's a big number. And so alcohol is a main cause of death for people who are developing alcohol-related cancers. So, as I said, IARC has classified alcohol as a human carcinogen, and this has really happened already a long time ago, where this first classification happened in 1988. So back then, the epidemiology was already very clear of this association between alcohol and cancer. And back then, the evidence was strong for an association with cancers of the oral cavity, larynx, pharynx, esophagus, so the upper aerodigestive tract that I mentioned earlier, and the liver. And again, the epidemiology in 1988 really showed this connection. IARC does update their evaluations periodically as the evidence, the scientific evidence, the studies are advancing, and there is more evidence to add to their classifications. And so in 2012, it was upgraded, that connection, and the risk associated with breast and colorectal cancer was also added to that classification. And so it was really clear already back then that there was this connection. However, despite the fact that we have known this for a long time, last year in 2025, the Surgeon General came out with this alcohol and cancer risk report to really highlight this connection and again show clearly the different sites for which alcohol is a risk factor, because it was clear that from studies that have been conducted in the US, not everybody knows about this connection. Actually, less than 50% of Americans seem to be aware of the connection between alcohol and cancer, while instead they are much better aware of the fact that radiation, tobacco, asbestos, or even obesity are a risk factor for cancer. So clearly, not as much advertisement in terms of looking at alcohol as a risk factor. And so the Surgeon General really came up with some information to really try to increase this general awareness. And one of the things that is interesting from the Surgeon General report is that they emphasize really on the evidence that shows that the risk of alcohol-related cancers are really evident and are starting to show even when people are drinking lower amounts of alcohol. So traditionally, also from the epidemiology that really was at the base of that earlier classification in 1988, it really seemed like the connection between alcohol and cancer came for those who were drinking really heavily. However, the most recent evidence is really pointing at the fact that there is already an increased risk for both women and men, and they are both reported in this figure that is coming from the Surgeon General report. Again, we're seeing an increase of the risk of alcohol-related cancers already for people who are drinking lower amounts, with an increase that is pretty significant at 1 drink a day and 2 drinks a day. When talking about specifically breast cancer, this is also important to point at, is the fact that even in this case, there is an increase in the risk of breast cancer that is already quite significant for amounts that are pretty low. So less than a drink per week, and then going up for 1 drink a day and 2 drinks a day. And so this really points at the fact that in the past, we had an idea that there was a difference that was really related to the amount of alcohol that people consume. And there was also a general sense that men were at higher risk of alcohol-related cancers because they were drinking more. However, we're seeing now that looking more closely at the data, we have an increase of the risk that is significant at lower levels. And so it's not just something that is related to people who are heavy drinkers. This is also coming out as a clearer picture when we look at the alcohol attributable deaths due to excessive alcohol use, and we see that overall, when looking at the cancers that are registered in male, you see that you have a higher number compared to females. But when it comes to breast cancer, then you have a number that is pretty high, and it's comparable to those cancers that are at higher that are higherly represented in male. So again, the difference is not just related to different amounts of alcohol that are consumed and the fact that that men are usually believed to be consuming more alcohol. And in fact, we also have some surveillance evaluations that are coming in, and this is a report on the amounts of alcohol that are drunk by men and women. This was in 2023, where we can see that people who are currently drinking, and you have the male in yellow and the female in that orange graph, are really drinking in amounts that are quite close. People who are binge drinking also, that is not represented there differently in men and women, and heavy drinkers again are represented in both sexes. And so again, there is this evaluation of the fact that men are drinking more, therefore at higher risk, that just doesn't quite stand with the data that we're evaluating and seeing now. So the problem is really that ultimately, even though we have this clear connection that comes from epidemiological studies between alcohol and increased cancer risk, we still don't know exactly what the mechanisms are. And clearly, as I tried to point out in the few slides before, it's not just a matter of how much we drink. It's really more of a matter of how our bodies are processing alcohol and how they're responding to it. And so we're still struggling in trying to understand exactly what are the steps that go from the exposure to alcohol to the actual initiation of cancers in the different sites that I mentioned. And again, the Surgeon General came up with a synthesis of some of the, or a summary of some of the mechanisms that have been attributed to alcohol consumption when thinking about how it induces cancer. And we can see that there are a number of them. And it seems like what also adds complication to the picture is that it seems like each mechanism may be more relevant depending on the site that we're looking at. So in the case of the first mechanism, which is related to the fact that alcohol or ethanol, when ingested, is metabolized to a reactive compound, which is called acetaldehyde. And acetaldehyde is reactive and can lead to DNA damage. And DNA damage can then, if not repaired properly, lead to mutations and cancer formation. This particular mechanism, and we'll look at it more in detail later on, seems to be particularly relevant for the connection between alcohol and oral cancer and cancers of the upper aerodigestive tract. We also know that alcohol consumption induces oxidative stress that is leading to the formation of reactive species again, and those reactive species can damage DNA, proteins, cells, and increase inflammation. And this particular mechanism seems to be relevant for the cancers of the liver. We also know that alcohol is altering levels of multiple hormones, including estrogen. And this is the mechanism that really seems to be at the base of that connection between alcohol consumption and breast cancer. And finally, we also know that alcohol is a very good solvent. Ethanol is a good solvent. And so it leads to better absorption of carcinogens. So when we look at the literature and the evidence that is looking at the risk for head and neck cancer in people who are drinking and smoking, that combination leads to an increase in risk that is more than just the addition of the risk that comes from smoking and alcohol alone combined. So there is a synergistic effect that seems to be really related to the fact that alcohol is increasing the solubility of the carcinogens that are present in tobacco. There's also another aspect of that particular mechanism, which is the fact that alcohol is increasing the permeability of the mucosa. This has been seen both in the oral cavity and then also in the colon. And so this could be a reason for not just being a solvent, but increasing the absorption of toxicants, genotoxicant or carcinogen, through increasing that permeability. And again, this is a mechanism that seems to be particularly relevant for that connection with colon cancer. So as you can see, depending on the site, depending on what we are considering in terms of what alcohol does, we may have a complexity of events. And so we're still trying to figure out exactly what happens and who are the people that are going to be more susceptible or more prone to develop a certain kind of reaction to alcohol, going through the different mechanisms from others that may not experience the same kind of event. So as I said, my lab specifically focuses on alcohol breaking down or ethanol breaking down into acetaldehyde and really tries to look at the mechanism that is connecting alcohol and head and neck cancer. So alcohol and ethanol is metabolized in the body through an enzyme that is called alkyl dehydrogenase into acetaldehyde. And as I mentioned before, acetaldehyde is a pretty reactive and genotoxic compound. Luckily, our body is equipped with another enzyme, which is the aldehyde dehydrogenase, represented here with the LDH symbol or acronym, which is really detoxifying acetaldehyde into acetate and then leading to its elimination. So overall, our system is well equipped to detoxify and eliminate acetaldehyde. However, we know that there are people who have a variation in the genetic encoding for this particular enzyme. And so around 30% of people from Eastern Asian descent, and so people that are coming from China, from Japan, from Taiwan, have this kind of inefficient genetic background that is encoding for an inefficient LDH to enzyme. And so in that case, we know that they are not as fast or as effective at detoxifying acetaldehyde because they only have 10% of residual activity of that enzyme. And indeed, the literature and the evidence is showing that if they drink, that they are at much higher risk for head and neck cancer when drinking alcohol. Interestingly, again, pointing at the fact that the mechanism may be specific to the head and neck area, they're not at higher risk for liver cancer or for breast cancer. So again, pointing at the fact that probably this acetaldehyde metabolism and effect is really mostly leading to an effect in the oral cavity. So people who are experiencing the activity of this inefficient enzyme are people who are usually flushing when drinking. And so maybe some of you are familiar with this phenomenon where they're drinking alcohol and then they get red in the face, they can develop nausea, they can develop some headaches. And so they're really not able to deal as well with the metabolic product of ethanol. So based on that evidence, we've really started focusing on whether we can understand what kind of effect this acetaldehyde is having in the oral cavity. And acetaldehyde is fitting very nicely in this general scheme of chemical carcinogenesis, where we have a chemical that is activated through metabolism and then is leading to DNA damage. Again, the activation here is to a molecule that is an electrophile that is very reactive, so it can lead to DNA damage. And we are well equipped with DNA damage repair systems, and so we may be able to get rid of all of these damage that happens. But if that does not occur for any reason, then we have potentially some genetic changes that then can lead to mutations and ultimately lead to cancer forming and developing. So we wanted to try to see, and we're trying to study this process and really see if we can put all the pieces in place to show that this is exactly what is happening in the oral cavity. So my lab has been working on alcohol studies that we have been performing here at the university for quite some time. They're usually studies where we don't have a lot of issues in recruiting. When we say that we're offering alcohol, people are always enthusiastic to be part of this study. when they actually see what we are offering them in terms of type of alcohol and drink that they have to drink, then the enthusiasm is a little bit lower. But in any event, we've been able to conduct these studies relatively easily. And we wanted to really see, can we indeed measure or see exactly and confirm that when people are drinking, they are indeed experiencing that metabolism, that formation of acetaldehyde, and that DNA damage is happening. And then how is that DNA damage being dealt with? Is it persistent? Is it repaired? So we had this study where we had people coming into our clinics. We had them give us a sample, like a brushing of their oral cavity, and then also we got some blood samples as well, to see if it's just something that happens in the oral cavity or is it more of a systemic effect. And then we gave them a specific dose of alcohol that was very much controlled and precise each time, and then sampled them at multiple time points after they did they consumed this specific dose of alcohol. This was, as I said, repeated for 3 increasing doses. The idea was to bring the participants to a blood alcohol level of 0.03, if with the first dose, 0.05 with the second dose, and 0.06 the third dose. So really trying to stay below the intoxication level, but also see if we could measure something if that was really increasing with the amounts that we were giving. And this is the beverage that we have been serving as a Smirnoff 100 proof with a high, so it's a stronger type of vodka. And I can tell you that since due to the study design, we have to start this in the morning, our subjects have not kept that enthusiasm very high when they started drinking this kind of mix. We are just mixing it with some tonic water. So not exactly the best drink, but certainly this was very helpful, because here are the results. We had a specific modification of DNA that we could measure using high resolution mass spectrometry. And I am reporting right here on the screen the chemical structure that we were able to measure. And we could see right here on the graph that at the base, the week before the dose, we had a certain level of this chemical that was present in the DNA of our participants. And right before the dose, it stayed at the same level. And then after the dose, it increased up to peaking at 4 hours, and then went down at 6 hours, 24 hours. Then the next week, they came in again. They gave us a baseline, which was similar to the baseline that we had before the first dose. And that led to, after the second dose, again, led to an increase in the levels of N2-ethyl-DG of this marker, and then which went down again. And then the next week, they had the third highest dose, and we had an even higher increase in the levels of these adducts. So with this study, we really confirmed that alcohol dose is metabolized into acetaldehyde, is leading to that DNA to be modified, and it's a dose response scenario that we're seeing, again confirming that it really came from the dose that we were administering. Interestingly, when looking at the blood samples that we collected from the same subjects, and we looked here at lymphocytes and granulocytes because these cells have different lifespans, so we wanted to see if there was a difference in either how sensitive they were to acetaldehyde or what kind of scenario they would show us in terms of short-term versus long-term exposure evaluation. But as you can see, even though when looking at the increase after the dose, you have some significant increase in the levels, there is clearly not a scenario that is as clear and as evident as what we're seeing in the oral cell DNA, which is on the left. So again, just to kind of reinforce the fact that looking at alcohol and the effects of alcohol can be quite complicated, because depending on what you're looking at, depending on the site that you are evaluating, you may have different scenarios. Just to reinforce this further, we also looked at different sites in rhesus monkeys that were coming from collaborators who had a study where they have adapted rhesus monkeys to drink alcohol ad libitum. So they're developing a dependence on alcohol, and they are exposed to different amounts that different animals will develop different consumption that is different. But we had the opportunity to look at what happens in tissues from the cheek, the esophagus, and the mammary gland in monkeys that did have an exposure to alcohol versus those that didn't. And so here you can see that, again, measuring that DNA damage through the evaluation of N2-ethyl-DG, we have a clear difference in the levels of this DNA damage in the cheek of these animals. The esophagus was a little bit lower, but still significant, sort of trending towards significance, although, again, it was not significant because the numbers of animals here was very small. But then the mammary gland, you can see that the levels were much lower and there was no difference. And so again, really pointing at the fact that depending on the site, we may have a different situation happening. So this sort of opens the question of what is indeed happening when we're looking instead of breast cancer and the connection with the mammary gland. As I said earlier, it really seems to be something that is related more to the interaction of alcohol with multiple hormones. So framing the context of alcohol and breast cancer, we know that the risk is increasing for each drink per day in both pre- and post-menopausal women. We know that around 4 to 10% of breast cancer in the USA are attributable to alcohol consumption, and this is resulting to numbers around 9,000 to 23,000 new invasive breast cancers that are present or that are detected each year. And what it seems also becoming more evident is that the exposure during adolescence and early adulthood seems to be more important than later in life, as to sort of indicate that alcohol consumption before there are changes in the breast, so specifically due to also a pregnancy, could be leading to thinking that there is a sensitivity of the breast tissue towards alcohol early on before you have these morphological changes in the breast. And so this, again, is part of the evidence that has been brought into this classification of the connection between alcohol and breast cancer. We know also that alcohol affects hormone levels. So alcohol is increasing circulating levels of estrogen through potentially reduced steroid degradation or an increased aromatase activity. Alcohol is also decreasing progesterone, although to a lesser extent than the effect that it has on estrogen. And alcohol is decreasing testosterone in men and is increasing it instead in women. So again, different mechanism, different scenarios, depending on the populations that we're looking at. So overall, the idea, the theory behind it, although again, we're lacking a lot of research really focusing on these scenarios, is that alcohol may influence breast cancer through ER-dependent pathways, increasing estrogen transcriptional activity, migration, and proliferation. And in fact, we are seeing that alcohol is strongly associated with hormone receptor positive breast cancers. What brings more complication to this scenario, though, is that we know also that sex hormones and stress hormones are influencing alcohol consumption. So depending on those levels, we may drink more or less. And so this, again, brings in some complication because it's hard at that point to understand if we're drinking more due to our hormonal levels or if it's the drinking that is affecting our hormonal levels. So it's clearly a complicated scenario that needs to be addressed with specific study designs that we certainly have not been able to conduct until now, and we don't really have a lot of evidence coming from anything that is really addressing these questions specifically. So ultimately, we're still trying to understand how all of these different mechanisms are coming together, depending on the potentially also with other risk factors, and really trying to understand how we can define all of these steps in the various processes so that we can better inform the public and really better understand who is more at risk. So the questions that we are still trying to focus on is really try to monitor the effects at low levels and over time. And so, as I said, in general, we have a lot of studies and a lot of bulk of the evidence that is coming from studies where the levels of consumption were very high. We're still trying to understand what happens when the levels are low from a mechanistic point of view also, not just from the epidemiological point of view, but from the mechanistic point of view. And what happens over time? Again, when is it that particular damage, for instance, doesn't get repaired anymore or is triggering the further steps in the process? We have now some approaches, omics approaches, metabolomics, exposomics, transcriptomics, proteomics, adaptomics that can really help us granularly looking at these processes more in depth. And so certainly there is the possibility to try to dive deeper in these steps, but we need to set up studies that will allow us to do so. And so there is certainly a lot of work that still needs to be done so that we can apply these techniques and try to better elucidate what happens in all of these different steps of the processes. We also need to focus more on sex differences and sex-specific variables. I've shown a few key points where those differences seem to really dictate variations that are either in opposite direction or are just specific for one sex versus the other. And so we are still trying to understand exactly how we can pinpoint what are these variables and how to address how they really are affecting this connection to make sure that we're able to really understand what happens in the different groups. And ultimately, we also need at this point to understand also if a decreased exposure or a cessation of drinking alcohol is then leading to a decrease of the cancer risk, just like tobacco smoking, where we know that cessation or that quitting smoking can really reduce your risk. In this case, in the case of alcohol consumption, we only know that that is true. And we know this because there is evidence that has been able to support this for esophageal cancer and head and neck. However, we don't have studies that are really helping us understand if this is happening also for the other cancers at the other sites. So clearly a lot more information that needs to be produced and a lot of more evidence that we need in order to tackle these questions. Because ultimately, we want to be able to really understand if we know the specific mechanism, the steps, and what happens, we can then understand what happens in each of us and really try to understand who are the people at higher risk and why is it that not all people who are drinking are ultimately developing that cancer, and why is it that some will develop one cancer and others will develop the other cancer. So we really need to understand more in order to be better equipped to really be able to inform people in the best way possible. Unfortunately, because we are missing information and we're missing part and we have gaps in the knowledge that we have about these associations, we are left to really just provide information on what we know and really provide information on potentially what are the best guidelines that we can have in terms of informing people about the risk and saying that is probably a good idea to drink in moderation. And although these dietary guidelines have been discussed and are probably going to be updated, till now we had in general, and also we do share similar guidelines also with the UK and other places in Europe, where in general we say that women should limit their drinking to 1 drink or less a day, and men to 2 drinks or less a day. Although we are seeing that these guidelines in other areas in the world are going to be pushed towards giving men and women the same kind of information about what is a moderate amount of alcohol that should be okay. But again, we don't really have a clear answer to what that moderation is. Another factor that comes in to complicate this is also that depending on the type of alcoholic beverage that we're considering, we may have differences in what we intend or what we think about a drink. What is a drink? What is a standard drink? And this is really important to understand that these are the amounts that have been allocated to describe a specific standard drink. And therefore, these are the amounts also that are considered in many of the studies, the epidemiological studies that have collected information on how much people drink, and that connection with consumption and cancer risk. So as you can see, you can have a regular beer that is 12 ounces. One standard drink of a wine, of red wine, would be 5 ounces. Considering though a wine that has 12% ethanol, and if you look at most of the bottles of red wine that we have available are usually higher than that. And so again, there can be variations, and really understanding what is a standard drink sometimes can be a little confusing and can be hard. And so again, it becomes really difficult to give and provide that precise information when even just defining what a drink is can be complicated and confusing. So what can we do with this information then? If we don't have a clear guideline for men, for women, for people with different risks, what can we do? We can say, and we can inform people about the fact that drinking in moderation is probably your best choice. And how does that translate into what we do daily? And so here I have a few tips that I've been sort of thinking about, and I've been collecting also from people who are addressing this question and have tried to be a little bit more precise in giving some recommendations. So in general, reducing the number of drinks or the volume, as we saw, there can be different ways of drinking and different ways of thinking at that one standard drink. So reduce the number of drinks or amount of alcohol that is drunk per drinking session. So that can be a good way to reduce the overall amount that we're exposed to. If we have days in which we have been drinking, potentially alternating those to a few days where we are not drinking alcohol could be a way to, again, allow the body to detoxify and to not get to a point where you keep on having that constant and continuous exposure. So alternate days in which you drink alcohol with alcohol-free days can be a good way to, again, reduce your exposure. Drink a lot of water while consuming alcohol. We certainly know from our studies in the lab and in the clinic that people who drink alcohol will be having a hard drink alcohol and then drink water will not reach the same blood alcohol level. Will take more time or more alcohol to reach that specific blood alcohol level. So water dilutes the amount of alcohol that we are consuming, and so that can be a way to again reduce the effects. Consume alcohol with food, and this is a big one, and it's really interesting to see how different culture experience this differently. So I can tell you that I am coming from Italy, and in my family there is a lot of red and white wine that is drunk at events and family dinners, but nobody ever drinks anything without their food. There is no sense of using alcohol without being accompanied with some of the meals that we're having. And so this is a good tradition that sometimes instead we have situations where we have hard liquor or cocktails that are consumed without having any food with it. And so again, that increases the amount of ethanol that we absorb because food is reducing that absorption. And so the idea of combining that drink with some food can be a good way to reduce the exposure. And then, of course, there is a way of considering alcohol-free alternatives. Luckily, we are at a point where a lot of those are being developed, are being advertised, are available. There's a really a large number of solution and options that we can have. And so those are ways to sort of alternate with the alcoholic beverages and consider, again, alcohol-free alternatives can be a way to alternate and to reduce overall the amount that we consume. So these are just some of the ideas or tips, sort of the bring home messages to make sort of this conversation also helpful for those of you who want to know or have a question about how we can really reduce that alcohol consumption. But more than anything, support more alcohol research is really the key for making sure that we get to a point where we can give more information, more granular recommendations. If we have more information on the mechanism that I mentioned before, what happens at lower doses, then we can start being more precise in giving this recommendation. And so I'm always adding this at the end because in general, knowing that alcohol is a risk for cancer is ruining the party, if we can say that. And so the idea is that there is sort of like a tendency to not want to talk about it or not want to really go into knowing more about what that means and why that is. And so instead, we need to talk more about it, raise more awareness about it, and raise the awareness that if we know more about what happens and we know more about these mechanisms, then we can also be more effective in helping people getting guidance, better guidance, and more effective guidance on how to consume alcohol. And so ultimately, the message here is that we're not trying to do work or to raise awareness to just ban alcohol or alcohol consumption. The idea is really just to raise the awareness of this connection, raise the awareness on the complication and the reasons why we're not able to be as precise and as good as predicting ultimately who is at higher risk versus who is not, or having ways to understand if certain type or certain ways of consuming alcohol, binge drinking versus earlier drinking in early adulthood versus later in life can change this risk. All of this information is going to be allowing us to be more effective in giving information and guidelines. And so the idea here is just to have awareness so that we can understand that slowing down drinking in moderation is a better choice than drinking without even thinking of the potential effects. And ultimately, the idea really is to be more precise so that just saying slow down can be quite vague and sometimes it's not going to be very effective. But if we have reasons why we want you to slow down, for instance, children crossing, then our attention into the side of the streets gets to be higher, right? So we pay more attention. Or if we know that it's going to be a slowing down, a request to slow down or an alert to slow down because the road is rough. And then we know that our suspension will suffer. So we start looking at the road and paying more attention to that. Or because we are been told to slow down because there is a dangerous curve coming ahead. So we can really make sure that we are clinging to the steering wheel and making that that curve more safely. So just to say that the idea here is to raise awareness so that people can know what their consumption is and know what some of the risks are, and then they can better make a decision for themselves, especially for those people who are potentially also at risk for some of these cancers due to other risk factors. So I think that knowledge really is power. And so the idea here is to give people the best knowledge and the best and more detailed knowledge possible. Ultimately, this is what this is all about. And so with that, I just want to acknowledge briefly the people in my lab who are helping me with all of this work. Certainly, there's a lot of work that goes into setting up these studies and then analyzing the samples, collecting the samples, getting to recruit people, understand who can participate, who cannot, and then analyzing the data. All of the work that we're doing is done here at the University of Minnesota, the Masonic Cancer Center, and is based on our ability to access Dr. Peter Villalta's analytical biochemistry shared resource here at the Cancer Center. So he's the director and his facility is instrumental for us to be able to produce the data that I have in part shared with you today. And then I also have to give a shout out to Kathleen Dubberly, who is an alcohol epidemiologist at the Minnesota Department of of Health, who has helped me keep this in the framework and in the context of what is happening here in the US. And so she really provided a lot of guidance in really framing some of the epidemiology that is relevant for this. And then, of course, the funding that is supporting the work that I do in this space, which is coming from NIAAA. And with that, I think I'm done with the boring part of the presentation. We are now at your questions, and I'm really looking forward to that because I'm really I know that people usually have some really good questions, and I think that this is the best part of this kind of interaction. So I'll let you guide this part, but again, I am looking forward to answering any burning question. Thank you.
Yes, thank you so much, Dr. Balbo, for that incredibly insightful presentation and for helping us better understand the connection between alcohol consumption and cancer risk and breaking down the science and translating it in terms of what it means for prevention and also everyday decision making. And so you also mentioned the importance of supporting research and, supporting research will help us to truly understand the risk associated, but also answering those pressing complex questions. And as you mentioned, the more evidence we have through research, the clearer the guidances that can be provided. So now we're going to transition to our discussion portion of the fireside chat. And so we've had so many questions already submitted, but if you haven't submitted your question already, please drop your question using the Q&A feature. And so we're going to try to get to as many questions as we can in the time that we have remaining. So we'll try to do it like rapid fire style. But before we get started, y'all already know it's not a fireside chat discussion without getting our fires started. So I'm just going to share our virtual fireplace. Okay. So let's see here. So many questions have been submitted already. Oh, I'm going to move that over. Okay, so the risk of breast cancer reoccurrence in survivors, is it the same as new cancers as it is related to alcohol consumption? So in a nutshell, is there higher risk for breast cancer survivors as it is for new cancer?
Yeah, that's a very good question. And I think that from all the meetings that I've been to where we have sort of analyzed this connection with breast cancer, I don't think that we have a lot of data really on the effects of alcohol on recurrence. So unfortunately, I'm not going to be able to really be very exhaustive in that, in that question, in answering that question, because I don't think that we have a lot of information on that, unfortunately. And again, the mechanisms that we have been highlighting as potentially being at the base of this connection are mechanisms that when someone goes through, a recurrence are not exactly the same. And so it's just going to be hard to address that question until we don't have really evidence that comes from studies that have been directing specifically survivors in this.
Okay. So are there cancer sites for which alcohol is likely a risk factor where the research isn't firmly established, but is emerging and strongly suggests that there is a link?
Yeah, very good question. I wouldn't be surprised if soon we'll have a reevaluation of alcohol and stomach cancer and pancreatic cancers have been sort of in the list of cancers that have been looked at, but for which there was not enough evidence to really support that connection to be so strong that we would just say, yes, there is a causal connection between the two. So we have a number of run-ups, and I think that those gastric cancer and pancreatic cancers are certainly there. Yeah.
Right. So somebody just said here, can you reiterate just to make sure, if people turn red and have a harder time breaking down some of, yep. So are these people at a higher risk of getting head and neck cancer?
Yes, yes. And that is very important because unfortunately, despite knowing this, despite having a clear epidemiological evidence that comes from studies done in Japan, China, This is not something that is commonly shared with people who are coming from that have descent and are coming from these areas in the world and that maybe are here. And so that is where I think we have a missed opportunity where we know something and we're not really providing that information. Where if you have this flushing experience when drinking, you're probably going to be at higher risk if you drink alcohol and continue to drink alcohol. And so for them, really the guideline would be to drink in moderation, but even less than the guidelines that are part of what I've shown the U.S. dietary guidelines. Yes.
All right, keep them coming, y'all. They're coming fast. So
Mhm.
here's a comment. So when providing cancer education to our clients, some have mentioned that mocktails, so non-alcoholic alternatives, are often priced similarly to alcoholic beverages. They may be more willing to choose the alcoholic option since it seems like it's the better value for the same price. While this is not a question, do you just have any thoughts on that?
Well, yeah, so I think that right now there is sort of like emphasis on these alcohol-free options, and I'm not an expert in policy and pricing of products, so I don't want to really give any kind of information on in an area where I don't have any expertise. But what I think is happening is that they are sort of niche products, and so they are probably using that as a way for them to price their products at a higher amount. I wouldn't be surprised if there could be also something related to the fact that if they are cheap and they are like priced as a Coke, then people will not think that they are as good or as exclusive as, a mocktail that you buy in a store. I think that from the perspective of people who are there choosing between an expensive drink and an expensive mocktail, ultimately the question should be more like, how much do I pay for my health, right? So I am willing to pay, a certain amount for a product that is going to be interesting in flavor, still stimulating as a cocktail, but it doesn't have that alcohol component if I think that it would be a good choice for me. And so I think that certainly a lot to chew there in terms of questions that, that comes with what then do we want to do in terms of strategies to help people reduce their consumption. But good question, and I wish I knew more about what is behind the policies and marketing strategies that are adopted by vendors that are producing these products.
Okay, another comment, question around mocktails. So a lot of these mocktails or these alcohol-free alternatives are usually higher in sugar, and we know that sugar-sweetened beverages are also linked to cancer. Are mocktails truly a form of cancer health reduction, and should we really be promoting them that way?
Mm. I think that we don't have studies where we have really done the comparison between people that are drinking, a true cocktail versus people that are drinking a mocktail. Again, the amount of sugar that is in a mocktail is high, is true, but I don't think that there is a clear association with sugar and a connection with cancer in the way that there is with ethanol and cancer. So I would say that in general, I don't see that as being, at the same level for that particular amount in a mocktail. But again, it would be interesting to really have studies that are addressing this particular comparisons. Currently, we are just starting to have these new products on the market. They are certainly not presenting the same amount of ethanol. And as I said, ethanol is, in the case of alcohol and cancer, the component that is driving that connection. So I think there is still some value, especially if they are a way for you to enjoy maybe an event or a situation where you want to still benefit from having something special, but you don't want to have the worry or thinking that you are drinking too much. And so again, as an alternative to reduce the overall amount of ethanol, I think that there is some value there. But I do agree that marketing them as an alternative that is healthy or is best, the jury is still out for that claim to be made.
Okay, so question here about the positive messaging that we've seen for years around the heart health benefits associated with wine. Do you think that is what has diluted public awareness around alcohol being classified as a carcinogen?
Certainly. I think that there has been a lot of talk about the beneficial effects of polyphenols in red wine, the Mediterranean diet, which is still something that is holding. So while the studies that are really focusing on red wine have been in general considered a little shaky and not really strong, so we are reconsidering really the value of those studies. The studies instead that are pointing at the Mediterranean diet as a valuable diet for health purposes do include red wine. But again, the way that the red wine is consumed in those diets is different. And also it may be that some of the other components of the Mediterranean diets have beneficial effects that are counteracting the effect of ethanol, which or red wine that in those contexts still is consumed in lower amounts. So I think that overall there has been a lot of information, and there's also a lot of use of alcohol in social settings. And so I think that in general, as always, bad news tend to or things that are ruining the party are something that people tend not to want to consider as much as those that instead are important or not having an effect or an impact on things that we do commonly with friends or with family or for celebration.
Definitely. And then we saw the headlines. They were very big, front and center around the heart health benefits of wine. And so
Yeah.
people want to hear what they want to hear. Okay, awesome. We are going to do two more questions. So sorry, everyone, if we are not able to get to your questions. There have been so many that have been flooding the Q&A, but we
Yeah,
are trying our best.
Amna, just quickly for all of you who have questions that have not been answered or we're not getting to my email, you look at me online, Silvia Balbo, you can find me online and I'm happy to address those questions via email anytime. So I just want to make sure that that's clear. So yeah.
Perfect. Thank you for that. We'll make sure to include your email in the follow-up email that will be sent out tomorrow to everyone who tuned in. All right. So do you foresee that there will be a time where we'll have the warning labels on alcoholic beverages around the cancer risks that are associated with alcohol?
I think that it will probably take time. There's a lot of work that goes into really the regulations that need to be implemented in order to get there. Um, I'm not opposed to that kind of labeling because, again, it's really a matter of raising awareness. And I
Mhm.
think that right now we can say that everybody or more people, certainly more than 50% of Americans know that when drinking alcohol during pregnancy, you are putting yourself and but specifically your baby at risk for defects later on. So again, is something that helps you understand and being aware of what happens, and then make that decision based on your own perception of the risks that you're comfortable taking or not. So a label of that sort would be just helping increasing the awareness and making sure that people know that there is this connection. But how fast that could happen if we're going in that direction, I would think that for now, I don't see that happening anytime soon.
Okay. Well, thank you so much, Dr. Balbo, for taking the time to answer the questions that we were able to get to and for sharing your expertise with us today. So before we officially close, what is one key takeaway that you would like our audience to leave with today?
The key message here is that science helps us understand better what we are surrounded by, what we do, and how all of these things are affecting our health. By knowing more, we can do better in terms of making the right decisions or taking our risk on our chances, but knowing that we have tools and things in hand that we can use to make those decisions with the best awareness possible. And I think that in that sense, knowledge, as I said, knowledge is power and science helps increasing that knowledge. It's not perfect because, as I said, things are complicated, and that is the reason why we cannot be so clear, crystal clear about what is good or not good for each of us, right? So there is that complication that comes in. But ultimately, the idea is to try to get as much information as possible, as solid as possible, so that we can make better choices.
Amazing. I think we'll leave it here. So thank you so much, Dr. Balbo, for joining us today. And thank you so much, everybody, for tuning in and spending your afternoon with us. So before you log off, I have just a few very brief items to close with. First, we would greatly appreciate if you could take just a few moments to complete our brief survey. It will auto-populate when you close out of the Zoom webinar, and then we'll also include it in the follow-up email that will be sent out tomorrow. Your feedback truly helps us continue to improve and to strengthen the series, but also to bring you timely and relevant topics that you want to hear about. And so as a token of appreciation for completing the survey, you'll have an opportunity to enter a drawing to win a prize pack filled with goodies from the Masonic Cancer Center. We also hope you'll join us for our next Fireside Chat on anal cancer on Thursday, March 26th at 1 p.m., same time, same place. It will be in recognition of Anal Cancer Awareness Month. That session will feature Dr. Elliot Arsenidonis. He is a colorectal surgeon at the University of Minnesota, and he's also the founder of Save the Bottoms screening program. And lastly, if you would like to stay connected with everything that's happening at the Masonic Cancer Center, be sure to follow us on all of our social media platforms, or you can subscribe to our monthly newsletter for updates, resources, and events announcements from the Office of Community Outreach and Engagement. Thank you again, everyone, for spending your afternoon with us. We look forward to seeing you next month. Take care, everyone.